advancing the jaws provides tension back there. And if you provide enough tension to prevent the collapse, then you fix the apnea, right? Okay. So we go back to the 90s again, and we go to Stanford, and we have some great researchers, Dr. Powell and Riley, who discover that if you take the jaws and you push them forward, you can fix sleep apnea. And I still remember this. I presented their paper. I was a resident at UCLA, and I was on the ear, nose, and throat service. And at the end of your service time, you have to present a paper, and then you present it to the attendings and the residents, and you present the paper and what it meant. So I presented Powell and Riley's paper that showed 90% improvement rate in apnea with maxillomandibular advancement. And when I finished presenting it, the attending said, "That's not right." And I said, "Well, what do you mean that's not right?" He said, that doesn't happen. And I'm like, well, I'm pretty sure this article just said it did. And then, of course, there's the other article they published a few years before with fewer patients that said that it did. Oh, and then there's Peter Waite's article that says that it does too. And there's Hochbahn's article. What are you talking about?
And then there's common sense.
Yeah, right. Common sense. Well, see, this is the interesting part about common sense, because the common sense then would lead you to say, let's go further forward, right? Well, Powell and Riley, when they did their surgeries, they went straight forward. So they took the jaws and they pushed straight forward, which made for some interesting faces. Because in the United States, one of the main patterns of the airway face is a steep facial angle, right? So the face grows down in the front like this, and we see this all the time in these airway patients. The face grows down. Well, if you're taking a face that grows down and moving it forward, you're not altering the positions of the chin relative to the nose. So what ends up happening is the nose part comes forward too far, which causes this to happen, right? And then the chin doesn't catch up to the lips, which leaves it recessed in the face. Doesn't work. It doesn't look right, and it doesn't work great, but it does address the apnea. So
and,
then along comes
for the audience, and so to foreshadow the adjustment that was made, or the improvement that was made to that, would be upswinging the jaws or counterclockwise rotating them, perhaps. Is that that's the solution?
That's the term. Yeah, that's the term that folks use, is this counterclockwise rotation. So then we discover, okay, in the long growing face, it's best to do this, right? To get the front closer together. Why is that? Well, guess what? It gets the lips together. So it's pretty cool. It also prevents the nose from, getting turned up. Okay. So that is brought to bear in the Arnett analysis, who's keeping track of occlusal plane, right? So he's now saying, well, let's rotate these airway patients and get a better face. And he does. And so people agree to that. And then there's some debate, is it still a good idea to do that in an airway patient? Well, in the end, you have to ask yourself, if you over-engineer a face, if you push it further forward for airway to the point of messing up lip closure or the aesthetic of the face, what do you choose? Well, that's a false choice. Like, if you say, for example, oh, I'm going to push further forward and we're going to negatively affect the aesthetics of the face, I'm going to choose function over aesthetic. That's fine. You can do that, right? But that's not your only choice. You have to recognize that airway is far more complex than a hard tissue architecture problem. And if you can't get a good airway by putting the face where it belongs, then maybe you've missed the underlying diagnosis or the concomitant diagnosis, meaning the other diagnosis that's in the face, right? So if you can't make a good face and a functional face by advancing the jaws just enough, but not too much, then maybe there's another underlying problem that you've missed.